Hello, it's me. I was wondering if after all this time you'd let me be without pain or frequency. Mom said cranberry will help to heal ya, but I ain't done much healing. Hello, can you hear me? I'm in the doctor's office waiting for a cup so I can pee, so I can get some fast relief. Yeah, I'll take 2 shots of what they got if that is what it takes. I'm not allergic to anything, so antibiotics are fine. 'Cause man, I've got a UTI. It feels so bad it makes me cry. When I go to the bathroom, it really breaks my heart, 'cause it feels so urgent, but then it barely starts. Boy, do I hate UTIs. Pain all around, plus the inside. E. coli bacteria. You really broke my heart, but it don't matter, 'cause these meds are gonna tear you apart, that's for sure.
A urinary tract infection is also known as a UTI. The urinary tract is made up of 2 kidneys, 2 ureters, a bladder, and a urethra. UTIs are a very common infection, and most commonly the bladder and the urethra are involved. Some signs and symptoms include pain, frequency, urgency, dysuria, confusion, altered mental status, blood in the urine, and cloudy or foul-smelling odor to the urine. The E. coli bacteria is responsible for most UTIs, and that's because it lives naturally within the bowel. Most commonly, the bacteria ascends the urethra, goes into the bladder, and there it attaches, colonizes, and causes infection. Some common diagnostic procedures include laboratory tests such as a urine dip, urinalysis, and urine culture. If there's a functional or structural problem, then other diagnostic procedures can include X-ray, CT scan, ultrasound, voiding cystourethrogram, and a cystoscopy. So who's affected by UTIs? Everyone's at risk for UTI, but it occurs most commonly in women. That's because their urethra is shorter than a man, and also because it's closer to the rectum. Risk increases with age due to a decrease in immune system function. Also at risk are patients who have diabetes, enlarged prostate, and kidney stones. Individuals that require a catheter, and also patients that have difficulty emptying their bladder, such as a spinal cord injury patient. Small fact, number 1 medical complication of spinal cord injury patients is a UTI. Prognosis for a urinary tract infection is usually good, and they usually have a good recovery. Infections can relapse and they can recur. To relapse means that the infection continues with the original organism that first caused infection without completely clearing. To recur means that another infection takes place after a successful treatment of the original infection. In some cases, infections can cause other conditions such as pyelonephritis, which is kidney infection, also kidney failure, and in serious cases, sepsis and even death. Some common medical treatments, it all depends on the patient, and also it depends on the organism that's responsible for causing the infection. Some common antibiotics are amoxicillin, Augmentin, Keflex, Rocephin, Bactrim DS, Levaquin, Cipro, gentamicin, and erythromycin. You can also be prescribed azo, or you can get that over the counter. It can help to ease pain and discomfort that comes along with having a UTI. As far as surgery goes, for UTI patients, it's not typical, and it's usually not necessary unless there's a major functional or structural problem. Some impairments, functional limitations, and disabilities. Some impairments include decreased strength, decreased coordination, altered mental status, and emotional issues. Some functional limitations include decreased balance, problems with walking, decreased ability to do bed mobility, and to do transfers. In some cases, UTIs can be very disabling. Severe cases can cause the inability to get out of bed, to participate in daily activities, and to go to work. So how are these deficits addressed in physical therapy? Well, patient education is very important. By emphasizing the importance of good hygiene habits with daily life, it is important for every patient, including those prone to infection. By educating the patient on preventive measures such as drinking more water, wearing cotton underwear and loose clothes, proper techniques with bathroom activities, for example, females should wipe front to back, good hygiene following sexual intercourse, men and women should both urinate after sex to help flush the bacteria that may have entered the urethra. Also, finishing all antibiotics prescribed. That's very important, not only for UTIs, but for any kind of infection. Also, bed mobility, especially in patients with catheters. This will help reduce the chances of the catheter being pulled out or being kinked. If the catheter gets kinked, it could obstruct the urine flow, and that could back up the urine back into the bladder and cause infection. So in teaching a patient bed mobility, it helps decrease the risk of acquiring a UTI. Also, pelvic floor exercises can be used. For example, a woman with a tight pelvic floor could have problems fully emptying the bladder. So using biofeedback and pelvic floor exercises, it could help with relaxation of the pelvic floor to ensure that the bladder is fully emptied. Some precautions and implications for the therapist. A person with a severe UTI may not be able to appropriately participate in therapy until the symptoms and the infection is under control and minimized. A patient can be lethargic, have fever, become nauseated, even begin vomiting. In some cases, and commonly seen with elderly patients, there can be an altered mental status and confusion. These symptoms increase chances of patient injury if not addressed quickly and appropriately. So if any abnormal symptoms occur, it is important for the therapist to acknowledge that and to notify the patient's nurse or physician. As I said, if a patient has a catheter, ensuring there are no kinks in the tube and there's an unobstructed flow of urine will help to minimize the risk for infection. So knowledge of catheter care is also important for patient safety. So what will affect treatment plan goals and or progression? Well, a patient just might not want to participate in therapy. They may just not feel like it. They could be lethargic. They could have that altered mental status or be confused and not be able to fully participate. Also, if they have a severe infection or if the infection causes other conditions such as the kidney infection, it could delay treatment. The delay could be short or long term depending on the severity of the infection. So in conclusion, infections are going to happen. It is important that medical personnel always strive to break the chain of infection by utilizing proper hand washing and standard precautions when in contact with patients. With good hygiene and passing along the knowledge of these habits, the number of infections can be reduced. So knowing signs, symptoms, and abnormal behaviors in regards to UTIs will help the therapist keep a safe environment. Thank you. The end. You didn't click the.
Yeah, I did.
You didn't click the button. It's not on the play. It's not on play.
Where's play? Play, play.
Not at the bottom. The arrow pointing to the right.
I can't see no arrow.
At the bottom of that screen.
Oh, right here.
Play button. Yeah. So get ready once you click play.